You've been diagnosed with obstructive sleep apnea, or you've struggled with CPAP, and you're wondering what options you have, or you're considering sleep surgical options at this point. So how do you know what surgery do you need to fix your apnea, or whether you could be a candidate for some other non-surgical options other than CPAP? So in this video, I will explain to you what a drug-induced sleep endoscopy is and why it is so important. And I will explain to you where we find common areas of obstruction. And I will also review with you what to do if you have a more complex upper airway. A drug-induced sleep endoscopy is a brief twilight examination for which I give my patients propofol so that they can fall asleep, they snore, and they develop apnea. And at that time, we advance a small endoscope through the nose and will visualize the upper airway and will identify the areas where obstruction occurs and the areas contributing to the patient's apnea. In some cases, that might be one area of obstruction, but not infrequently, we find that more than one, possibly two or three areas need to be addressed so that the air can again flow back and forth so that we can prevent these low oxygen levels at night that are so damaging. If we identify, for example, a base of tongue obstruction without any further areas of concerns, you might be a great candidate for hypoglossal nerve stimulation, which is otherwise known as Inspire therapy. However, not infrequently, we do find that patients have additional oropharyngeal or retropalatal obstruction, which is the area around and above the tonsils and that space right above that arch that has the uvula dangling off it. So if that is the case, then patients need to be counseled on the fact that they may actually need two surgeries. Because if we only told the patient that there is one surgery involved, patients wouldn't necessarily feel better. And so by identifying the areas involved contributing to the apnea, we can not only develop a surgical roadmap for patients, but we can also set expectations. This endoscopy will also allow us to determine whether, for example, surgery can be combined with some other tools, for example, a mandibular advancement device. So in other words, the sleep endoscopy is a core examination that will allow the surgeon to develop a roadmap, a treatment roadmap for sleep surgical patients that have been unable to tolerate their CPAP device.